As this is the third Africa Health ExCon, we've witnessed two great conferences in the last 2 years, and the conference aims really as building strong collaboration between the African governments in healthcare. In Novartis, we also take this level of collaboration very seriously. We've been in Africa for quite some time, and we really take the opportunity of best practice sharing and what we could have done well and share it with other countries, and vice versa when another good experiences can be shared. In Novartis, that's a topic that we're embarking on, have been embarking on for quite some time, and we've set our goals aligned with the ESG WHO goals. And there are a lot of parameters that we're doing well at in Egypt, especially in our manufacturing site. Another important area that could be of great use is partnerships. And in a country like Egypt and in Novartis Egypt, we've been very successful working hand in hand with different health authorities and public and private health institutions about very relevant partnerships in specific disease areas. We've partnered with the Egyptian Health Authority. We signed an agreement end of last year. We've had an agreement, signed a collaboration agreement with the Ministry of Health earlier this year. We've also signed with private institutions and hospitals, aiming at improving the outcomes in cardiovascular diseases. We've been a main partner for a couple of years now with the Women's Health Initiative, aiming at improving the outcomes for breast cancer women in Egypt. The conference mainly aims about collaboration between African governments in healthcare, trying to improve outcomes for our fellow African citizens in different countries. Novartis has shown a very big interest in serving patients in Africa, and we've done that in different ways and shapes. We exist in many African countries, and where our largest presence is in Egypt, but even in countries in the middle of Africa, sub-Saharan Africa, where we figured there is a need for a special strategy and approach. We've built our sub-Saharan African Novartis unit. We've been in Egypt for over 60 years with our manufacturing site in Sawah. We also have been exporting many of our goods to different countries, including countries in Africa. We've exported 23 million units. Out of those countries are Ghana, Cameroon, and we continue to do so. When we look at innovation, it's part of our DNA in Novartis. Innovation comes in research and development, providing the most innovative treatments, also comes in finding the most innovative ways to partner with health authorities and with private institutions in order to bring innovation to as many patients. In Novartis Egypt, we provide over 2,700 jobs, either directly or throughout our supply chain. Our manufacturing site in Sawah adds to the economy, creates jobs, and exports to several countries across the world. Our societal impact in Egypt last year has exceeded $900 million US. That's something that we continue to be proud of, that we add to the society and we add to the economies we operate in, and we do that in Egypt. Last year, we've initiated a program called Horizon for integrating people with disabilities into the workforce, really bringing them in, upscaling them, and really trying to make them part of the workforce, whether in Novartis or in other places, something that I'm really proud of, and we're building on it.